Hey, my name is Matthew Belzer. Welcome back. This is Lecture 5, Basics of Medical Terminology, and this is the fifth lecture in a five-part lecture series, really over the blood. But I'm deviating a little bit from anatomy and physiology topics to just touch on the basics of medical terminology, and I do this for a few reasons. One, the language of anatomy and physiology is largely rooted in the language of medical terminology. So if you understand the way that language is structured, the way that medical terms are put together, it goes a long way to having the linguistic tools to be successful in a class like anatomy and physiology. Two, I want you to be able to communicate more effectively with colleagues, particularly in clinical fields later on down the road. And three, I want you to get into the habit of breaking words down into their constituent parts, into their building blocks, because if you look at words from that linguistic perspective, you start to understand and make connections that you otherwise wouldn't. So as always, I've provided you with a set of learning objectives. You can print out your lecture handout and have it out and available, or you can have it up digitally and just kind of follow along today. So why is medical terminology important? Well, number one, medical terminology allows us to avoid things like medical error because everybody is using the same set of linguistic tools, right? So it allows us to avoid medical error, and it does that by standardizing the way we communicate. So whereas somebody may call this the hand, another person may call this the palm or whatever it is, and you can get rid of all that ambiguity by using kind of precise medical terms. So it provides a standardized way to communicate so there's no confusion about what somebody's talking about, and that helps to avoid medical error, having a standard way of communicating, right? And in that standardization of communication, it allows us to make accurate diagnoses. So medical terminology is the language of medicine, and it amazes me that it was cut from the curriculum with respect to prerequisite courses for the nursing program. Now, they did that because they were under pressure to trim down the number of credit hours in the program, but still, it's such an important class. I mean, you use medical terminology all the time, and it's important for a variety of reasons. Notably, it standardizes the way we communicate, so there's no ambiguity. It's not fuzzy. You're not like, well, did he mean this or this or that? Right? You know what somebody's talking about when they use precise medical terms. So when you think about medical terminology and when you think about these long convoluted words you look at in an anatomy and physiology class, a lot of these words are broken into different parts. So the beginning of the word is often a prefix, and prefixes modify the meaning of the word with respect to shape, size, direction. I like to think of prefixes and suffixes as being about something. So is it about shape? Is it about size, direction, location, color? What is the prefix about? How is it modifying the word? The root is the body of the word. It's often a body part, but it's not always a body part. And sometimes prefixes and roots, like the distinction, can be tricky. We're not going to get into that. A root is the meat and potatoes of a word. It's often a body part, but not always. And the suffix is also about something, but it tends to be about a diagnostic test, a professional, or a condition that's being suffered. And that'll make a lot more sense as we kind of start looking at some of the words we're going to be going over today. So medical terms tend to have a prefix, a root, and a suffix, or just a root and a suffix. It's very common to just have a root and a suffix. And when I think about prefixes and suffixes, I think of them as being about something. They change the meaning of the word, and what are they about? What are they talking about? So let's go ahead and look at a few of these. About size, macro means large, micro means small. So if you tack that before another word, right, you change the meaning of the word. Or megalo or megaly, right? If you say cardiomegaly, it means an enlarged heart because card is a word root that means heart and megaly is a suffix that means enlarged, right? So you look at all these, and I'm not going to go through and read through every single one of them, but a lot of times they tell you about the meaning of the word, and I threw in these guys over here because I wanted you to be familiar with them as well, and I'll talk about, I'll highlight why. Now, suffixes, whereas prefixes tend to be about like size or where something is or a color, or an amount of something, or is it high or low in the terms of hyper or hypo. Suffixes tend to tell you about problems. So suffixes here that I definitely want you to be familiar with are itis and osis. Itis is a condition of inflammation. Osis is a disease condition, usually non-inflammatory. So that's why you'll see itis and osis in certain things. Path always means disease. Now, it's weird because you can use path as a prefix or a suffix, and I'm not going to be a stickler about those rules or how you use them or what. I'm just going to show you kind of how medical language is structured so you get in the habit of dissecting things into their components, right? You look at a word and go, well, what does that word actually mean? What is that word telling me? So when you think about there we go. So you have prefixes and suffixes. They're about something. So as you kind of go through these, read through them, and then you look at about procedure. Well, that's an ultrasonic wave. Electro means electricity. Ectomy means surgical removal of. A graph is a process of taking a picture, whereas a gram is a picture. So you hear an electrocardiogram, that's a picture of the electrical activity of the heart. Right? You hear an electrocardiograph, that's the process of getting that picture. There's a little distinction there. They are slightly different. Otomy is making a surgical incision or opening in something. So you've probably heard of like a colostomy bag, which has a surgical opening in the colon to allow things like non-digestible material out if there's a problem, or phlebotomy. Phlebotomy is a surgical opening in a vein. In fact, when you get a blood draw, the people who do it are called phlebotomists. And phlebotomists, right, are just making surgical openings in blood vessels in order to extract blood, right? You don't think of it as being a little surgical procedure. It's kind of categorized that way. So again, look through these. Be familiar with them. You see the suffix synthesis, like amniocentesis. That is the surgical removal of fluid, right? And in that case, the amniotic fluid. So understanding these prefixes and suffixes and seeing how they're kind of tacked onto words to modify their meaning is important. Now, word roots that I want you to be familiar with, you can all find right here, right? I think that many of you are probably already familiar with the overwhelming majority of these. You're going to see this language over and over, so it's not a terrible idea to get an idea of what you're talking about. So, for example, if you ever use adenoma is the cancer of a gland, right? Aden just means gland. If you throw in adenitis, that's inflammation of glands. So these word roots are important, and you can kind of go through them. Card is a word root that means heart, and you can kind of go through and look what they pertain to and what they actually mean. So if you see phleb or phlebo, what you're talking about are veins, right? So a phlebotomist makes a surgical opening in a vein in order to extract blood. And I think everybody actually should get phlebotomy certified before they even go to a nursing program. It's a great 1-month program that tacks on some real concrete skills that you can include in your resume. So go through and look at these guys, and then we're going to talk about how do we combine prefixes, roots, and suffixes to make words, and what are the types of questions you're going to see. So we know that words can be broken into prefix, roots, and suffixes. Sometimes there's just a root and a suffix. So let's see how this is structured. Hematopoiesis. So I go, oh, that's a long, convoluted sounding word, and we've talked about it quite a bit this semester. What does that actually mean? Well, we go back here, and you go blood, heme. So heme means blood. So I go, oh, hematopoiesis. So I know that it has something to do with blood, and let's see if I can find what poiosis means here. Well, genesis or poiosis means making. So if poiosis means making and heme means blood, hematopoiesis is the making of blood. And in fact, as we know already, hematopoiesis is the process by which stem cells turn into either white blood cells, red blood cells, or platelets, right? So the word begins to make a little bit more sense if you have that just kind of basic knowledge of how medical language is put together. This O, by the way, here that you're looking at is what's called a combining form. You combine a word root with a suffix with the letter O when the first letter of the next word root or the suffix begins with anything other than a vowel. So if this is A, E, I, O, or U, you don't include the O, right? It just goes from word root to suffix. Anything other than A, E, I, O, or U, you link a word root with the combining form O to the suffix of the word or the next word root, right? So I'll show you what I mean. Angiogenesis. So ANG means blood vessel, and if we look back, genesis means making. Angiogenesis is the making of blood vessels. Because angi means blood vessel and genesis means making, how do we combine those two? Well, I look at this first letter in my suffix and I go, is that a vowel? Is it A, E, I, O, or U? It is not a vowel. So I include the combining form O to latch this word root to this suffix. On the flip token, let's look at adenitis. So aden means gland and itis is a condition of inflammation. Why don't I say adenoitis? Well, I look at the suffix and I see that it begins with a vowel, A-E-I, so it begins with a vowel. Therefore, I do not use the combining form O to latch the word root to the suffix, right? And you look at this and it's all about just breaking down what this means. Gland inflammation. Adenitis is inflammation of a gland. Thyroiditis, again, just kind of emphasizing you can throw thyroid and then itis at the end. It's inflammation of the thyroid gland. The reason you don't use that combining form O is because itis begins with a vowel. So you don't ever do that when something begins with a vowel. Phlebotomy. So phlebe means vein, right? O is the combining form, and T-O-M-Y is making a surgical opening into. So phlebotomy is making a surgical opening into a vein, right? And a phlebotomist is just somebody who takes that syringe and draws your blood. Now, when we think about where we can, how we use things like prefixes, roots, and suffixes, here we have a prefix and a word root. So you look at AN. AN, if we go back here, means without or reduced. So we know that's reduced, and anemia is a blood condition. So you go, anemia is a condition of reduced blood, and in fact we know that that's a condition in which the percentage of red blood cells drops in whole blood, or you develop your hematocrit drops. So we look at this. Leuc means white and cyte means cell, combining form O because C does not begin with a vowel, A, E, I, O, or U. And then we can have a prefix, a root, and a suffix. And some medical terminology professors will tell you to read a word backwards, right? So you go itis, inflammation of, card pertains to heart, and peri means around, inflammation surrounding the heart. Pericarditis. And in fact, that's inflammation of the sac called the pericardium that surrounds the heart. So all of this language can be broken down into constituent parts, and you can kind of get a better idea of what people are talking about. Not to mention, if you're ever looking through like a medical chart and you just don't know what a condition is, if you have a basic understanding of medical terminology, even if you've never heard of a condition, you can start breaking into prefix, root, and suffix and go, all right, I don't know what odontalgia is, but I know dont means teeth and algia means pain. So odontalgia, obviously, there's pain in the mouth or pain in the teeth that this person is complaining of. So little things like that. Now, another way that questions could come at you, and these would be multiple choice questions. Again, this isn't a medical terminology class. I just want to get some of the basics down. A word that means surgical opening in a blood vessel. Phlebotomy. A word that means insufficient thyroid hormone production. So we have hypo, which means below, thyroid, right, which pertains to the thyroid gland, and ism, which is a condition of usually, right, it doesn't imply inflammatory or non-inflammatory, it's just a condition of, so a condition of hypothyroidism. Break the words down. A word that means inflammation of a blood vessel, right? A word that means slowing the flow of blood. And we talked about this in the previous lecture. You look at the word root that means blood, it's heme. And then you look at the suffix that means slowing or staunching the flow of, that's stasis. So hemostasis, there's a combining form O in there because stasis begins with something other than a vowel, is slowing the flow of blood, right? Now, another thing that we commonly use in medicine and anatomy and physiology are eponyms. Eponyms are just conditions or procedures that are named after specific doctors. So they get their name after somebody. They were named after something. So when you see an eponym in medicine, or I'm going to use the eponym for that, I mean, I'm going to use, if I call it an islet of Langerhans, that's an eponym. Right? I'm naming a structure in the body or condition or whatever it is after the scientist who played a major role in discovering it or characterizing it. So we talked about Addison's disease, talked about Cushing's disease. Those are named after different researchers that played a major role in our understanding of it. An Alice clamp is just a surgical clamp that holds soft tissue together. I bring it up with respect to the cardiovascular system because oftentimes we clamp arteries and veins shut during things like surgical procedures using what's called an Alice clamp. You also got acronyms. Acronyms are when you have a term and you just use the first letter of each of the words in the term as a shorthand abbreviation, and we use those all the time, like PTH, parathyroid hormone, GH, growth hormone. A few that may pop up on something like an exam, and they may just be embedded in a question, are things like HRT, hormone replacement therapy, NSAID, non-steroidal anti-inflammatory drug, or PT, which is prothrombin time, which we talked about in the previous lecture. The rule of thumb, if you ever throw an acronym in, let's say like you're writing a paper, you always define the acronym once. So you'd say like prothrombin time, parenthesis PT, and then after that, after you've defined the acronym once, you can use it whenever you want. Now, frequently used abbreviations. Abbreviations are a little bit different than acronyms because they're not necessarily using the first letter, they're just abbreviating something. So if you see AC, it means prior to a meal. PC is after a meal. BID means twice daily. TID means 3 times daily. GTT means drips. So you often set IV fluids or intravenous fluids as drips. IM is shorthand for intramuscular. Often with injections, you do IM injections directly into the muscle. Potassium and sodium, you already know the chemical symbols for those. PR means per rectum. QD, that means a drug must be taken 4 times daily. When you say Q number H, it's indicating this drug should be administered every blank number of hours. So Q2H means every 2 hours. Q12H would mean every 12 hours, right? In the AM and the PM, stat means immediately. You already know the medical terminology with the quadrants. CC is chief complaint, BP is blood pressure, C and S means culture and sensitivity test, CBC means complete blood count, DWBC means differential white blood cell count, DX stands for diagnosis, T for temperature, DM for diabetes mellitus, DVT for deep vein thrombosis. These are just medical terms that are used all the time. And because you don't want to have to write that out every time if you have a patient with a DVT, you don't want to write deep vein thrombosis 45 times in clinical settings, you can just use the abbreviation.